ሰላም ሰላም ውድ የመረሲፍ ዩቱብ ቻናል ቤተሰቦች ዛሬ ይዤላችሁ የመጣሁት የነርሲንግ ሲኦሲን ከፓርት 3 ከ21 እስከ 30 ያለውን ጥያቄዎችን አብረን የምንሰራ ይሆናል። ስለዚህ ከመጀመሪያ እስከ ፍጻሜው አብራችሁን ሁኑ። ማልስ ብቻ ሳይሆን ከነራሽናሉ ነው የምናየው። ሰብስክራይብ ላይክ ማድረጋችሁንም እንዳትረሱ።
21. A 6-day-old neonate was admitted to a hospital for management of breathing difficulty. The neonate had spontaneous breathing at birth, but breathing difficulty started on second day of birth and worsened on the fourth day. The neonate was put on continuous positive airway pressure ventilation. What is the best and safest method of checking the progress of this neonate? A. Pulse oximetry. B. Blood gas analysis. C. Pulmonary function test. D. Carbon dioxide monitoring. Answer A. Pulse oximetry. Pulse oximetry provides a non-invasive and continuous measure of the neonate's oxygen saturation levels. It is crucial for monitoring the effectiveness of the CPAP and assessing the neonate's respiratory status without causing additional stress or discomfort. While blood gas analysis can provide more detailed information, it is more invasive and typically not the first choice for routine monitoring in stable situations. 22nd to 15-day-old neonate was brought to a hospital with a complaint of difficulty of feeding of 1-day duration. The neonate had history of convulsion. On examination, the neonate had also trismus and irritability. What is the most likely diagnosis of this neonate? A. Sepsis. B. Tetanus. C. Meningitis. D. Hypoglycemia. Answer. B. Based on the clinical presentation of the 15-day-old neonate, the symptoms such as difficulty feeding, history of convulsions, trismus, lockjaw, and irritability suggest a diagnosis of B. Tetanus. Tetanus in neonates can present with irritability, difficulty feeding, and trismus due to the spasm of the jaw muscles. The history of convulsions can also be associated with tetanus, as the spasms can lead to seizure-like activity. Neonatal tetanus is often linked to inadequate vaccination of the mother during pregnancy or unsterile practices during delivery. 23. A nurse was giving resuscitation for a newborn by using bag and mask ventilation. After a minute of resuscitation, the neonate didn't start spontaneous breathing and had pulse rate of 90 per minute. What condition makes the nurse to stop resuscitation? A. No spontaneous breathing after 10 minutes. B. Breathing less than 30 breaths per minute after 10 minutes. C. Breathing less than 30 breaths per minute after 20 minutes. D. Pulse rate of less than 60 beats per minute after 20 minutes. Answer D. According to the American Heart Association, AHA guidelines for neonatal resuscitation, if a newborn requires resuscitation, the heart rate should be monitored closely. If the heart rate remains below 60 beats per minute after 20 minutes of resuscitation efforts, it is an indication to consider stopping resuscitation. The condition that makes the nurse stop resuscitation would be D. Pulse rate of less than 60 beats per minute after 20 minutes. 24. A 12-day-old neonate was brought to a hospital with a complaint of fecal rad all over the trunk for 1-day duration. On examination, the neonate had normal platelet count, increased prothrombin time, and increased partial thromboplasts time. What additional information is the most likely used to identify the neonate's problem? A. Neonatal history of bleeding. B. Maternal history of infection. C. Neonatal history of vitamin K injection at birth. D. Maternal history of warfarin use during pregnancy. Answer D.
A 12-day-old neonate presented with petechiae, normal platelet count, increased prothrombin time, PT, and increased partial thromboplastin time, PTT, indicating a bleeding disorder related to coagulation factors. The most relevant additional information to identify the problem would be the maternal history of warfarin use during pregnancy, as this can lead to vitamin K deficiency in the neonate, resulting in coagulopathy and the observed bleeding symptoms. 25. A low birth weight neonate was brought to NICU with the clinical features of unable to breastfeed, difficulty of breathing, and yellowish discoloration of a body part. The neonatal nurse classifies the neonate as jaundice according to IMNCI. What is the most likely finding used to confirm this classification? A. Yellowish discoloration of palm and sole. B. Yellow skin and eye, and baby is 6-day-old. C. Yellow skin and eye, and baby is 16-hour-old. D. Yellow skin and eye, and baby is 7-day-old. Answer B. In the context of confirming jaundice according to the IMNCI guidelines, the best option would be sad face B, yellow skin and eye, and baby is 6-day-old. This finding confirms jaundice because it indicates that the jaundice has persisted beyond the typical physiological range, which is important for classification and management. 26. A 4-year-old child was presented to the health center with diarrhea of 5 days duration. On physical examination, the skin pinch goes back within 2 seconds, and the child was very eager to drink water and had weight for height z-score greater than -1. What is the most appropriate management of this child according to IMNCI? A. Give ORS over 4 hours period. B. Give ORS solution in each loss. C. Give RESO-MAL solution in each loss. D. Give RL solution intravascular over 3 hours. Answer A. In this scenario, the 4-year-old child has diarrhea for 5 days, and the signs of dehydration are mild, as indicated by the skin pinch returning within 2 seconds and the child's eagerness to drink water. According to the IMNCI guidelines, the appropriate management for a child with mild to moderate dehydration due to diarrhea is to provide oral rehydration solution, ORS. The most suitable option in this case is sad face A, give ORS over 4 hours period. This approach allows the child to replace lost fluids gradually and safely, ensuring adequate hydration while being attentive to the child's desire to drink. 27. An 8-month-old infant was brought to a pediatric OPD with the clinical features of cough and chest indrawing. The respiration rate of the child was 48 minutes. What is the most likely classification of the infant according to IMNCI? A. Pneumonia. B. Cough or cold. C. Severe pneumonia. D. Very severe disease. Answer equals A. An 8-month-old infant presents with a cough, chest indrawing, and a respiratory rate of 48 breaths per minute. According to the IMNCI guidelines, the infant's symptoms align with the classification of pneumonia, as it includes both cough and chest indrawing while maintaining a respiratory rate below 60 breaths per minute. Thus, the child is classified as having pneumonia. 28. An infant who was born from a known HIV-positive mother is brought to a pediatric OPD with the clinical features of cough, stridor, and oral thrush. The HIV status of the infant was positive for antibody test and unknown for DNA/PCR test due to unavailability of the test. What is the appropriate management for the child according to IMNCI? A. Initiate PMTCT care. B. Initiate ARV treatment. C. Advise on HIV prevention. D. Advise to stop breastfeeding. Answer is B. The infant exhibits symptoms, cough, stridor, and oral thrush, suggesting possible opportunistic infections due to being born to an HIV-positive mother and testing positive for HIV. According to IMNCI guidelines, PMTCT care is not applicable for diagnosed HIV-positive children. Instead, it is crucial to start ARV treatment for those with immunocompromise. HIV prevention advice is directed at caregivers, and discontinuing breastfeeding is not recommended unless there are specific risks. Therefore, the recommended action for this infant is to initiate ARV treatment. 29. A 30-month-old child was brought to the health center with a complaint of cough of 3 weeks duration. The nurse identified that the father of the child is on initiation phase of TB treatment, and the child also had low-grade fever. What is the most appropriate initial step to do for this child? A. Refer urgently to the hospital. B. Initiate INH as TB prophylaxis. C. Put the child on anti-TB treatment. D. Counsel on the diagnosis of TB exposure. Answer is B. In evaluating the child's symptoms of cough and low-grade fever following exposure to a TB-positive individual, an urgent hospital referral may be necessary if severe illness is suspected. However, if the child's condition is stable and symptoms are not severe, the standard protocol is to initiate isoniazid, INH. prophylaxis to prevent active TB. The appropriate course of action depends on the clinical assessment of the child's overall condition. 30. A 10-month-old HIV-exposed infant was brought to the under 5 clinic for routine checkup. The nurse immediately took DBS sample and found DNA PCR test positive. What is the most appropriate initial step the nurse should do? A. Take DBS to repeat viral test. B. Start ART as soon as possible. C. Start cotrimoxazole immediately. D. Start ARV prophylaxis immediately. Answer equals B. Since the infant has tested positive for HIV, initiating antiretroviral therapy, ART, promptly is crucial to improve health outcomes and reduce the risk of disease progression. While cotrimoxazole prophylaxis is important for HIV-infected children, the priority here is to start ART immediately.